Hello, my name is Corwin Cooper, and this is my presentation on the psychodynamic model of family therapy for Troy University. The psychodynamic model is primarily concerned with insight, motivation, unconscious conflict, and attachment. Now I will speak briefly on the impact of Sigmund Freud on family therapy. Sigmund Freud, the founder of psychoanalysis, worked with a 5-year-old boy named Hans, who refused to go into the street for fear that a horse might bite him. Freud hypothesized that he was displacing anxiety associated with his Oedipus complex. According to Freud, Hans unconsciously changed his intense fear of castration by his father into a phobic symptom about being bitten by a horse. Having substituted the horse for his father, Hans was able to turn an internal danger into an external one. The fear was displaced onto a substitute object, which is prototypically what takes place in the development of a phobia. Historically, this case has conceptual as well as technical significance. Conceptually, it enabled Freud to elaborate on his earlier formulations regarding psychosexual development in children. Technically, it marked the first case in history of both child analysis and family therapy. Alfred Adler, from the Freudian school of thought, developed views that were divergent from psychoanalytic theory, emphasizing the importance of social, including family factors, as opposed to Freud's drive theory. He studied the whole person and was less concerned with unconscious motivation. Adler offered a theory rooted in social relationships. All behavior is propulsive and interactive, and the basic social system is the family. Adler formed the Society for Individual Psychology in 1914, which was a group that underscored the importance of the total individual in any therapeutic undertaking. Harry Stack Sullivan trained psychoanalytically, but was also influenced by sociology and social psychology. Sullivan stressed the role of interpersonal relationships within the family and with outsiders in personality development. He argued that people are essentially products of their social interactions. Sullivan stressed the importance of peer relationships in personal and social development, believing that seeds for later were sown in early dealings with others. Emphasized the crucial nature of the early mother-child dyad, arguing that these formative experiences lead to viewing parts of oneself as good me, bad me, and not me. The classical psychoanalytic theory, psychodynamic view of individual behavior focuses on the interplay of opposing innate forces or drives within a person as the basis for understanding the person's motivations, conflicts, and symptomology. Drives motivate behavior by means of bodily demands that take the form of unconscious wishes. Each drive has 4 components, the first of which is aim, the release of sexual or aggressive tension. The second is source, in the case of hunger, bodily need for nourishment. The third is impotence, the pressure or urgency of the drive. And the fourth, object, person, thing, or condition which would satisfy the drive. Heinz Kohut. Heinz Kohut is responsible for a major development in contemporary psychoanalysis. He published a provocative, controversial series of books challenging some basic tenets of classical psychoanalysis, such as its drive theory. His work was based on his work in analyzing patients with narcissistic personality disorders. He developed self-psychology theory, in which he argued that narcissistic personalities result from a failure in childhood to develop confident feelings about oneself as a result of poor experiences with inadequate or unavailable parents. As a result, narcissists, self-centered and with a powerful need for attention, admiration, are likely to see themselves as the center of all relationships. Nathan Ackerman began to attend to the family itself as a social and emotional unit whose impact on the child needs exploration. He made clinical assessments of entire families and devised clinical techniques for applying psychoanalytic principles to treat preschool children and their families. Ackerman began family therapy explicitly in the 1950s and opened the Family Institute in New York in 1960, which soon became the leading family therapy training treatment center on the East Coast. Sometimes thought of as the grandfather of family therapy, saw the family system as a system of interacting personalities. Each individual is an important subsystem within the family, just as the family is a subsystem within the community. James Framo stressed the relationship between the intrapsychic and the interpersonal, offering a mixture of psychodynamic and systems concepts. He was one of few psychologists in the early family therapy movement. Framo began viewing family dysfunction as rooted in the extended family system. He developed a set of intervention techniques that help couples in marital therapy deal with unresolved issues each partner brings to the marriage from his or her family of origin. Framo theorized that a young child who interprets parental behavior as rejection, desertion, or persecution is in a dilemma. The child cannot give up the sought-after object, the parents, nor can he or she change that object. Typically, the ensuing frustration dealt with by the internalizing aspect of the love-hated parents. This concludes my presentation on the psychodynamic model of family therapy. I hope the information presented was informative and useful.